This afternoon, new and tighter restrictions are taking effect as the government steps up the fight to slow down the spread of COVID-19 here in Ghana. In his update number 23 last night, President Akufo-Addo said the country's situation is now dire as hospitals are full of many severe and critical cases of infection.
As of Friday, 29th January, 64 more people have sadly died over the last 2 weeks, bringing the total number of confirmed deaths to 416. Our hospitalization rates are increasing, with the number of critically ill and severely ill persons now at 172. Our hospitals have become full, and we have had to reactivate our isolation centers. Our average daily rates of infection now stand at 700, compared to 200 2 weeks ago. The total number of active cases has more than doubled, from a little over 1,900 2 weeks ago to 5,358 currently. When I delivered update number 22, 13 out of the 16 regions had recorded active cases. Today, all 16 regions have active cases. Indeed, Greater Accra, Central, Western, Ashanti, Eastern, Upper East, Upper West, Volta, and Northern regions are the hardest hit, accounting for 94% of the total number of active cases.
Well, to address this, a number of new restrictions, as you may be aware of, are being introduced, including a reintroduction on the ban on mass gatherings.
Until further notice, funerals, weddings, concerts, theatrical performances, and parties are banned. Private burials with no more than 25 people can take place, with the enforcement of the social distancing, hygiene, and mask-wearing protocols. Beaches, nightclubs, cinemas, and pubs continue to be shut. Our borders by land and sea remain closed. All workplaces, public and private, must employ a shift system for workers, in addition to the use of virtual platforms for business or work. Conferences and workshops can take place with all the appropriate protocols. However, I encourage the use of virtual platforms for such engagements. Restaurants should provide takeaway services and should, as much as possible, avoid seated services. The National Sports Authority and the Ghana Football Association should ensure compliance with the 25% capacity rule in our stadia, with spectators respecting the social distancing rule and wearing of masks. To the revered leaders of our religious organizations, that is our churches and mosques, I entreat you to enforce to the letter the protocols relating to attendance, i.e. the 2-hour duration, 1 meter social distancing, mask wearing, use of sanitizers, and the presence of Veronica buckets, liquid soaps, and rolls of tissue paper.
As President Akufo-Addo there, he's also been announcing a comprehensive enforcement plan to ensure that there is total compliance.
As we step up public education and enforcement of the protocols and public gatherings, let me also state that regulatory agencies will undertake random checks to ensure conformity with these rules, and the security services will be tasked to enforce them. You do not have to be arrested by the police before you wear your mask. Your workplace should not be closed for non-conformity with the protocols. If there's no urgent reason for you to be outside, please stay at home. Each one of us can help to contain the spread if we continue to practice the measures of social distancing, washing our hands with soap under running water, refraining from shaking hands, and wearing our masks whenever we leave our homes.
Well, so how do we feel about this? There have been mixed reactions to this ban placed by the president on weddings and funerals due to the rising COVID-19 cases. Well, while some say it is a good initiative, others have expressed worry over the debts that they are incurring due to the plans that they'd already made.
Funerals and other occasions is something that is designed in such a way that people will come together. You get it. So definitely there will be contacts. And I think basically my knowledge about this COVID is that when people get in contact, they can easily transmit the disease. You get it? So there's no other way.
I think what the government, the president of this nation has done, I think is the best thing for us. And I believe that each and everyone should comply to the directive that he has put into places. So I think when we follow it as Ghanaians, I think we will do well.
So long as it is in our own interest, I don't have anything about it. So it is okay. We have to wait and see what will happen in the future.
It has affected me. I don't know if it is positive or negative because as I speak, the remains of my dad is in the morgue, and then we're planning his funeral actually for this month. So with the president placing this restriction of about 25 people for funerals, I think it's a blow, but I don't know if it's positive or negative because it also means I'll cut down costs in terms of people, feeding, refreshment and stuff.
Honestly, I think he should have given a week or some days notice, because I was listening to the radio this morning and a lot of...
Well, let's have a conversation on the back of this. I have Dr. Da Costa Abuaji. He's leading the risk communication for COVID-19 at the National Response Team. Doc, thank you. Good afternoon. Our concerns have been raised about enforcement. Is there a plan to carry this out as robustly and as carefully as we ought to, given the situation we're in right now?
Thank you so much. Let me greet your viewers. Certainly, there is a plan. We have been engaging the Ghana Police Service. I think over the last 2 weeks, I have personally had meetings with them, and for them to enforce the regulations put forward by the EI. And I think they've also said that they will be introducing some innovations where, for example, if you are in a trotro and you are not wearing the mask, they will actually pull you down and maybe give you a mask or ask you to buy. Again, I've also noticed that they themselves are using their outlet to promote the wearing of the mask, which is actually good. And like the president said, they would actually be going around to do random checks in the various pubs and the places that are closed, the beaches and other places, to make sure that this is enforced strictly. Let me say that at the moment, until we get the vaccination, these restrictions and the safety protocols are our solution. And that is why we keep emphasizing, we keep stressing, there is no way out. The only way out is for people to comply with the safety protocols. We shouldn't be tired of wearing the face mask because, it is the solution to, it's the solution to our problem as to how we have to fight this virus. We shouldn't be tired of washing our hands because it's actually part of the solution. And the virus is actually not tired of us, so we shouldn't also be tired.
People are asking is, why do you reimpose restrictions on mass gathering and not extend that sort of into our taxis and our trotros and our, public buses or public transport system, because we know how crowded it can get?
Oh, thank you. The things that we have done are guided by data. For example, I haven't really, I haven't seen any case from any transport operator, but what we have been doing is that we are engaging the GPRTUs, the Ministry of Transport, so that they extend, they are able to educate their members on how they are able to open their windows, compliance to the safety protocols. And like I said, the police will also be supervising or enforcing the law in terms of the wearing of face masks in those vehicles. So I think it is in order that we do that. But in terms of parties and funerals and weddings, our data is actually clear that those are actually sources of infections for us. That is why we have concentrated on them. Another source is also the workplace. This virus actually thrives very well in confined spaces, especially air-conditioned space. So it is the reason why we are saying that if you are in an enclosed area, open the windows for open air to come in there. Because I think when you do that, obviously you limit the rate of spread within such an environment. The social distancing at workplaces is very important. It was also clear in the president's speech that we should adopt a working shift system and make sure that we use virtual means where necessary to do our meetings, workshops, and conferences. So I think all these things are just to limit the spread and reduce the numbers until we get the vaccination in.
Hello, Doc. I wanted to ask you a follow-up question on the public transport. To what extent is it even realistic to say that the windows in a trotro, as we know it in Ghana, for example, is safe enough with all the number, is safe enough at full capacity? I mean, are we not just not being realistic if we pretend as if that is not a problem?
No, I don't think so. You see, if you are in a public transport, and for example, you don't talk to anyone and you are wearing your face mask, certainly you are okay. And if windows are open, the air will come in. Obviously, it will be open air ventilation. So I think those are some of the processes that we have actually gone through with the DPRTU, the Ministry of Transport. And it's about continuous education to their members that this is what they should continue to do. That is why we also encourage all passengers to wear their face masks, because that is very, very important. And they should also limit talking in those transports. So I think they are aware, and as the police are going to help us enforce it, I think they are okay.
The police themselves have also come up for criticism about how they arrest. The very first, for example, arrest was made, and people said that you look at this video and you saw how people have been cramped up in one room. Has there been a change in strategy when it comes to arresting people, even if we're saving them from themselves, but putting them together and creating another something that experts have called super spreader avenue?
Yes, I mean, obviously you are spot on. So we are engaging them to see how best we obviously work together on some of these things. But I'm sure that we'll communicate the challenges to government, and if there is a review, they'll communicate to us. But I can tell you that we are working with the police in reviewing some of these things, because obviously one of the protocols actually says that we should avoid crowded places. So if you are arresting people into crowded places, then so I remember when we were discussing, one of the things that came out was that when they arrest the people, they should separate them obviously they shouldn't just put them together. So I think those concerns have actually been expressed by the police themselves, and we are working on it. And this is why we also ask them to also come up with some innovations to implementing the EI 64.
Well, look, there's one thing that I want to talk to you about, but I want us to look at a bit more of the coronavirus-related stories that have come in, and then we'll take that one as a final question. We want to understand whether or not there is a risk communication strategy. It's something that experts have alluded to and said it could be very, very helpful, but it has to be very timely.
There is certainly
I'll come to that, Doc. Just hang on with me if you don't mind. Right, I see the book there, but just hang on for me. Now, I want to take you to Kumasi, the Ashanti region, where frontline health workers there have served notice that they will lay down their tools over what they're calling unpaid allowances. They're about over 200, and they are aggrieved frontline health workers who attend to severe and critical ill COVID-19 cases at the Komfo-Anokye Teaching Hospital. But they are unhappy with what they say are disparities and discrimination in the payment of insurance packages promised them by government. Ohim Interior has been investigating the concerns of these health workers, and he has put together this report.
Komfo-Anokye Teaching Hospital takes care of pediatric and critically ill adult COVID-19 cases. As at January 26, 2021, at least 251 positive cases, representing 48.9% of samples taken, have been treated at the facility. But taking care of COVID-19 positive cases comes at a cost to medical staff. They risk their own lives.
In fact, the team that manage COVID cases at Komfo-Anokye are very, very, very efficient. They work diligently to be able to care for the patients well.
The government in April 2020 promised to pay 50% of basic salary of frontline health workers. It also announced insurance package for medical staff who contract COVID-19 in the line of duty. But the supposed beneficiaries say they are yet to benefit, especially from the insurance. According to them, some administrative staff who are not frontline personnel but lately contracted COVID-19 have been paid the insurance ahead of them. The aggrieved health staff have threatened to lay down their tools.
Those who manage the cases, nurses, doctors, contracted it as early as May, and their names were sent to the ministry for payment. Those people have not received it. And people who are not clinical staff, but staff of Komfo-Anokye, but they don't manage patients like an accountant or a health service administrator. I know two people who are not clinical managers, but contracted it in August, and they have been paid. There's a growing disenchantment and serious uproar. People are not happy. Now, if you are not careful, most of our people are going to lay down their tools.
The strike could be widespread as colleagues from other hospitals in Ashanti and other regions have threatened similar actions.
The danger is the first week of February. If we are not being careful, before we realize, there will be a day that you go at the treatment center and there will be nobody there. Other hospitals are also trying to gather their tools and then decide that, oh, this is our working tools. We are not going to work until we receive our monies.
The Ghana Medical Association is worried about the situation. Ashanti Regional Chairman Dr. Pakwesi Bedu says some members are owed about 3 months arrears of the 50% basic salary promised them, plus the insurance packages.
The last check, people were complaining that for 3 months, they owe them an arrears of 3 months. And this is from a platform of doctors. We have over 2,000 doctors on that platform. That's where the complaint was coming from. The Ghana Medical Association national leadership have taken it up. We use this medium to urge our Minister of Health designate and our Finance Minister designate that if they've really paid health workers this amount, they should let us know the names, the facilities.
Management of Komfanoche Teaching Hospital has also expressed frustrations in the payment of insurance packages to staff at the facility. Medical Director Professor Bafo Kofi-Poku have been speaking to the issues.
It is beyond our capabilities sitting here as to why they have not been paid. We sent the list to the Ministry of Health. The Ministry of Health scrutinizes it and sends to the Ministry of Finance. So the payment comes directly from Comptroller and Accountant General directly into their bank accounts. When it comes to the insurance, we compiled a list from April to October and sent to the Ministry of Health. The total list was 351. The ministry sent us a list of 71 as those they have shortlisted. So we go back to the ministry and asked, what was the criteria? We are on the ground. We know people who have been infected. Before we can say, Jack, we got wind that close to 40 people in Komfanoche have received some amount of money, being insurance money from government. I have no idea how the selection was done.
The effect of frontline health workers laying down their tools could be dire, especially on potential COVID-19 positive cases.
It's like a revolution. Whenever there's a revolution, people die. After that, the right thing is being done. If you are left with no option, that's the only action that you have to take. That's the only message that they are ready to hear. And that is the message we are going to send them.
Until government addresses these concerns, the worst could hit the country's healthcare delivery. From Kumasi, for JoyNews, Ohime Interior reporting.
Well, Ohime is joining us via Zoom right now to join Dr. Da Costa as we have this conversation about our cases. Ohime, has there been any development on this story so far?
Not really, not at this time, but what I do know is that the workers at Komfanoche Teaching Hospital are happy that they are able to articulate their issues in the media, and hopefully they believe the Ministry of Health and the Finance Ministry will attend to the issues and address them as quick as possible. If not, then they will be faced with no other option than to lay down their tools.
Let me throw this to Dr. Da Costa, see if he can help us with some sort of answer. Doc, you've had the concerns about being what they're calling disparities and discrimination when it comes to government-promised interventions for people like them. I don't know, does this, trigger any answers that you can help us with?
I think listening to them, I think I deduced two things: the 50% and the insurance. Mm-hmm. Now, for the 50%, to the best of my knowledge, what we normally do is we work with the facilities for them to submit to us frontline workers. And all those that were submitted, and I think it goes through a validation process. Those ones, to the best of my knowledge, they've been paid. So if there are issues, then I think I'll inform the Director General and the Minister designate so that we can contact Komfanoche and quickly see how we can address that. Okay. In terms of the insurance, I think it's also the same process. To the best of my knowledge, some people have actually received their insurance. So they may have a genuine concern. So I think we may have to quickly look into this. But normally, like, we are the headquarters, so we will always work with the facilities that they've been working in so that we are able to address some of this. But I think, thank you for bringing it to my attention. I will immediately speak to the Director General and communicate the outcome to you.
Okay, so sounds good. Doc, still stay on with me. It looks like we may quickly get some response, but have the authorities at Komfanoche Teaching Hospital themselves responded to these concerns and allegations?
Gifty, the management at CAS itself is frustrated because they say that, for instance, when you look at the insurance payment, first they submitted and shortlisted a list of 371 beneficiaries. These are people who are staff of the hospital and at one point has contracted COVID-19. And later the response that they got from the ministry was that the ministry has shortlisted 71 out of the 351. So if you compare these numbers, then the indication is that there's a backlog of staff at Komfanochi Teaching Hospital who contracted COVID-19 and has not been paid of the insurance package. For instance, the medical director, Professor Bafo Kofi Koku, mentioned that at the time that they were engaging the ministry as to why 71 of the 351 names submitted could be, approved by the ministry, then they heard about 40 of the 71, people have started receiving payment.
Okay.
So it's something that he says the hospital has no, hand in the payment, and this is done at the ministry and is paid to the accounts of the beneficiary. So he says they've been engaging the Ministry of Health on the issue.
Ohemi, thank you very much for this. As Doc has said, he will pass this message on to headquarters, and hopefully we'll get some response between now and hopefully by close of week. Ohemi Teria is my colleague there joining us from Kumasi. I still have Dr. Da Costa Abuaje. Doc, let's wrap up. We talked about the risk communication. Before that, quickly, let's address the issue about vaccine. We know that President Akufo-Addo has indicated that there is a target of 20 million Ghanaians. But is there a clearly laid down procedure when it comes to how this inoculation will be done? I know this might not necessarily be within your purview, but what information do you have that you can share with us?
I think for me, I worked on the subcommittee for communication on the vaccine. But what I can confirm is there is a clear national plan for the deployment and also around the vaccine. And it is the reason why the president was able to make some of those categorical statements. So what I will say is that, as long as it's ready, we will certainly either through the Director General, the Minister, or the President will actually make known. Then we will take it from there. So, but I can assure you that there's a plan to that.
One other plan, which is right there on your lap, is the risk communication. Health experts have said that we are not communicating perhaps the risks enough, which is why Ghanaians, first of all, went apathetic with the protocols in the first place. Is there, and I've seen the book, beautiful book, but at the end of the day, is there a plan to lift up that information that is in this book and share it abroad and make sure that the information actually seeps in? If there is the plan, do share with us so we can help you to share it abroad as well.
Okay, so thank you so much. There is a comprehensive plan for the risk communication. In fact, the President's weekly updates as part of the risk communication. We, from our level, also do have our regional offices. These regional officers do engage the various stakeholders, the NGOs engage, we do house-to-house education, we engage on various radio discussions. The Ministry of Information actually has been helping us in weekly press briefings. And not only that, the ISD at some point also came in to help us. In fact, the MMDAs they've also activated their public health emergency committees, which includes risk communication. In fact, to the best of my knowledge, every Ghanaian, trust me, knows about COVID-19. But the fact is, you see, in terms of behavior change, and like I keep saying, this is not part of our culture. So we just have to continue to reinforce the messages, coming up with various means to reach the public so that the public will take ownership of what we are saying. The fact is, the virus also keeps evolving. It's a novel virus, and communicating some of those things is actually difficult because, as scientists, you really have to get the data to inform your communication. So as the data comes in, we try to change our strategy. again, bear in mind, when the disease keeps going down, during those times when the disease was going down, that was when people thought the disease was actually gone. So it is a difficult process. Change, that is how it is. But I'm beginning to know that, you see, with this enforcement that came in, you could see that people have started wearing their masks, and people do know that the risk is there. But as to whether they will actually accept to comply with is what was actually left. But I'm sure that with this enforcement that the president and other stakeholders playing the part, I think it will all come on board. It's not a simple fit approach. It is an all-inclusive approach. This is why we keep every day hammering on the protocols. Countries like New Zealand and Australia, now today as we speak, New Zealand have no case. And how did they do it? They did this through wearing of the mask, the safety protocols, and the whole world. The safety protocol seems to be our lifeline. And
but perhaps they had a risk communication plan that we should or we can learn from. Maybe that's what we're lacking. That's what's not putting fear enough. It's not putting fear in people enough for them to start wearing the mask and be obeying the protocols.
Yeah, in fact, if you look at the last few days, you see when the cases have actually gone up, you see that people are now afraid in spite of even the enforcement. So people are complying. So there are various strategies, like you can put fear in people. Like people are saying that they haven't actually seen dead bodies. So that's why they are not actually complying. So I saw, in fact, it was Joy FM. You went to, I think, you went to one of the hospitals and you were showing pictures of those people who were actually sick and then narrating what they are actually going through.
Yes,
and
the producer of this program did that.
In your medium, you've been playing a lot of messages from various, obviously, healthcare professionals, and also jingles and other things are being played on radio through, that's what we call the above the line. So those strategies, I think we have. And we have also done a little bit of community engagement. We engage the chiefs to make they understand what is actually going on. And those are the things that we have to let the people, the engagement that we have to do for the community, the people to obviously own the safety protocols. So we continue to do it, but I mean, we can share the plan as well, the national plan.
I think you should share so that we can, help in the dissemination of this information.
On our website for everyone to have a look.
Very well. Doc, thank you very much for your time this afternoon. Dr. Dacosta Abuaje there, he's in charge of risk communication when it comes to our COVID response in this country.